Kerala has long been celebrated as India's model for public health. From high life expectancy to strong healthcare delivery, the state has often set benchmark for the rest of the country. But tonight, Kerala is facing a growing public health challenge, not from a new virus, but from something far more basic: contaminated water. The state is witnessing recurring outbreaks of waterborne diseases such as hepatitis A, shigellosis, norovirus infections, acute diarrheal diseases. Last year alone, Kerala reported more than 31,000 hepatitis cases and 82 deaths. This year, 9,000 cases and 25 deaths have already been recorded. Health experts say that the problem is not failure of the hospitals or doctors. The real issue lies beneath the surface. More than 60% of Kerala's population depend on groundwater drawn from millions of wells. Studies have found high level of fecal contamination in majority of those water sources. The bigger concern is infrastructure. Despite rapid urbanization, Kerala still has extremely limited sewerage network coverage. Most households rely on septic tanks located close to drinking water sources, increasing the risk of contamination. In many areas, water pipelines are close to sewage drains, creating further vulnerabilities. The result is a cycle of recurring outbreaks that no amount of medical treatment can alone solve. So the issue is, a state that is so advanced, so literate, so educated, why has it failed on the water and sanitation issue? Why can't it have its proper sewer system? Why can't state organize it? Why only 12% of the area connected with the sewers? On this issue, I am joined by Dr. Subramaniam Swaminathan, Director of Infectious Diseases from Glen Eagles Global Hospital, Chennai, and Professor P.S.N. Rao, Dean, School of Planning and Architecture. Thank you, both of you. Let me straight away go to Professor Rao first. I mean, so I was taken aback by the data which was thrown at me. I mean, such an important state, very well educated, and it hasn't got its sewer system okay.
Yeah, you see, this is really very unfortunate. The system of providing sewerage and clean drinking water supply treated, this is referred to as public health engineering for the simple reason that the provision of these engineering systems has a direct bearing on public health. Unfortunately, today, the subject of public health engineering is a grossly neglected area. Now, we also have to understand that in Kerala, the settlement system is such that it is very scattered. You don't have compact settlements where it is easy to provide a sewerage system. So that makes matters only more complex than in other places. So therefore, it is even more important to provide sewerage systems in a state like Kerala, where you have the urban and the rural, there is a continuum. You don't know where the city ends and where the rural areas begin. So it's a very big challenge. And unfortunately, no investments are being made. This has not even been recognized as a serious problem. So one is clean drinking water. And when we talk about clean drinking water, we are dependent to a great extent on underground waters. And underground water is contaminated because of the septic tanks. So it is a vicious cycle. And unless and until these problems are addressed, unless and until heavy investments are made in this sector, we are waiting on a ticking time bomb, and this could lead to something much more dangerous than what we are already seeing.
Okay. Okay, Dr. Swaminathan, your opening comments on the data which I am putting it on here. I find it very ironical that it has happened in a developed state like that.
I would say it's probably because they are honest in reporting numbers. I would ask, how honest are the other states in reporting their numbers? So it's difficult to say, it's easy to say that they are doing a bad job. I would argue saying they are doing a good job in at least being transparent about it and being honest about it. They are acknowledging that they have a problem. Remember, they've been able to control Nipah only because of their honesty and their transparency. So, and they did a fantastic job with COVID as well. So, yes, there are shortcomings, and like Dr. Rao beautifully explained, it is the demographic and the lay of the land has changed so quickly, they have not really kept pace with it. And it is very difficult to keep pace with it when it is all scattered hamlets. And also keep in mind that this kind of haphazard urbanization is not just in Kerala. A lot of natural runoff of water and water capturing bodies have been taken over and converted in many states, including my own state in Tamil Nadu. The vanishing lakes across India are a testimony to that. So we don't have ability to catch rainwater. Rainwater tends inundating all these places. And obviously, when you have septic tanks as a primary way of disposal, it is a recipe for disaster.
But what should people do, sir? I mean, the hepatitis A, hepatitis B. What should people do? People have actually died with the brain meningitis because they were swimming in ponds, and they died. I mean, so that's a very horrible way.
So again, you are discussing about too many different things all at the same time. The brainworm that you're talking about, the parasite that you're talking about, Naegleria, is unrelated to the floods. That's there in these contaminated water bodies for a very long time. It's not new. So I think we need education of people living in that area saying, please be careful, this water is contaminated, you shouldn't be doing it. And the contamination exists irrespective of the flooding situation.
Okay.
Now, the flooding situation obviously is a concern. So we saw something even more catastrophic in 2015 in Chennai. But the point is, I think aggressive measures, both in terms of public health and also education, is very, very key. So, like I said, how do we handle the excess water? It's still something that many of us are struggling with. But having said that, telling people not to wade in pools of water, making sure they have safe water supply. See, the Swachh Bharat Abhiyan mission is honestly the most important step in public health. Ensuring good water supply and sewerage is the keystone of good health for any country. So telling people that, make sure you boil your water. Now, that's not too difficult at all. Make sure you boil your drinking water and make sure that your food is uncontaminated. Those are the keystones right now in minimizing the damage. Also telling people to stay home and to have a war footing of distributing food and whatever supplies that need to be done. And minimizing them coming onto these flooded areas is probably also key.
Okay, that's an important point you have made. Professor Rao, what should states like Kerala be ideally doing? I mean, so, we don't live in a dictatorial societies like China or Russia where diktats can be immediately translated into action. What should be done in Kerala? If there is such a limited network of pipes, and the research we did also found that the primary issue was also that the both water drinking pipes and the pipes for the use for toiletry were actually together. So, in a breakage in one would affect the other.
See, this is really very surprising because we are told all the time that Kerala is one of those states where urban local self-government is very, very active. People's participation is very high, levels of literacy are very high, and so on. But apparently, the kind of basic awareness and education that is required, that is perhaps missing. That training is, of course, required to take the precautionary measures, as the doctor very rightly mentioned. But at the same time, the municipal bodies, they are the bodies which are responsible for public health in the city. So, therefore, it is absolutely necessary that they invest in proper sewerage systems. You don't have to have a very costly system in place. There are several alternatives also which are available. So decentralized systems are also available, and these need to be employed. So therefore, unless and until you do this, there is just no other way in which you can tackle, because we are going to generate waste, and we need to tackle that waste. The other is the industrial pollution. I mean, people are digging deep tube wells everywhere and anywhere. So there is absolutely no check on this, and I'm surprised. There are many parts of Kerala which are actually below sea level, and the groundwater table is quite high. So the possibility of contamination of fecal matter with drinking water supplies is also very high.
In Kerala, the fecal contamination was confirmed in the 70% of the open wells by state agencies such as Center for Water Resources and Development Management. And sir, in Thiruvananthapuram in 2018, it was reported the coliform contamination was prevalent in 73% of wells.
So the data very clearly speaks that unless and until you improve the infrastructure, you just can't tackle this problem. Of course, you can keep telling people you wash your hands, boil the drinking water, etc., etc., etc. All that has to be done in any case. But in the long run, unless and until you improve the water and sewer infrastructure, and unless and until you look at technological alternatives which are actually available. So unless you do that and make the investments there, you just can't tackle this problem, because it's going to occur and reoccur every year. And matters are only going to get worse.
Or is it because of the fact, Dr. Swaminathan, it's like you don't take water pollution seriously. It's like, you take anything which goes wrong in the heart very, very seriously. You may not, if something goes in the liver, people say, "Arey, kam khana khao, you'll become okay." But something goes wrong in the heart, you say, "Arey," you rush to, you go to the hospital. It's about how you take things seriously. Even water contamination can create real deadly problems for you.
So, if you look at the life expectancy in the US, thanks to infections, the most powerful intervention was public sanitation, water supply, clean water supply, and sewage. That's what brought down mortality in the early 1900s. More powerful than antibiotics, more powerful than vaccines. As a single public health investment, sewage disposal and good freshwater supply is critical. But keep in mind that all our water sources are contaminated. I challenge you to find a single water source in India that is not contaminated. You can talk about degrees of contamination, but not uncontaminated water. Second, the truth of this is borne out by the fact that everybody today is investing in an RO system at home.
Yes.
Why do we need RO systems? I've used a filter for a very long time because fortunately I live in a city, probably in a locality where the water supply is actually quite good. It's well chlorinated and I don't have a significant problem. But I cannot say the same about most places in India and many other localities in the city that I live in. So please understand that this is a widespread problem. You're right in that Kerala being caught like this looks a little unfortunate. But have in mind that this is also the effect of unplanned development. Yes. When you allow people to start building houses and whatnot willy-nilly, and you close up water channels which allow the stormwater to run away very quickly. See, my friends used to tell me, it will rain in Kerala, but within half an hour, all the water will run away. How is it that we're having floods today in Kerala?
Yes.
Why is the water not running off? If you have water standing like this, stagnant like this, that is a recipe for disaster. If it keeps running off, the risk is much lower. So there is a problem which is not being addressed in terms of the urbanization and unplanned or rather poorly planned
So we have completely, I've run short of time, but we have completely changed the morphology or geography of places. Look what we have done in Delhi, Aravalis. Now you have got those winds coming to Delhi, which, that was not there 30 years ago, 35 years ago. You have dust storms in Delhi. Aravali was supposed to protect it. If you look at the sort of plunder that is taking place in the Western Ghats, Sahyadris, that's another story. And most important of all, which is a run of water, you go to mountains, Uttarakhand and Himachal Pradesh, you have parking lots that have come up. Those secondary lakes and the primary places where the water would collect, they have all disappeared. So either you have floods or, there is no place for the water to stop.